Welcome to the Healthusiasm podcast, a panel discussion on trends and innovations in health and self-care. My name is 𝗵𝗲𝗍𝗀𝗃. I'm the author of the Healthusiasm books and a professional keynote speaker on health, business, and technology. Every week, I discuss with a panel of experts the positive changes that are shaping our health and happiness. And for this discussion, we have a full panel. Calling in from Barcelona is our digital health connector, Aline Noizet. From Scotland, but living near Brighton, medical expert in digital innovation, Dr. 𝗁𝗲𝗍𝗶𝗰𝘀.
Fit like 𝗵𝗲𝗹𝘁.
And last but not least, from Ghent, Belgium, human experience expert, 𝗵𝗲𝗿𝗀.
Hallo, hallo.
Hallo, hallo. All good?
Very good.
Okay,
Sunny
well, let's
day.
get... Say it again?
It's a sunny day. You can see the sun shining on my
Yes.
chin.
Is it? I mean, it's not even... In Belgium, that's not the case. It's still cold. I just recently saw this meme where you see Anthony Hopkins with a cross doing an exorcism, making sure that December leaves April.
It's been cold. Been cold.
Because it feels so cold indeed. Time for some Healthusiasms. In this week's episode, we will discuss the Healthusiasms of the month April, not December, April. Some positive changes that we have seen in the past weeks and that we would like to share with our listeners. Without further ado, tell me, Aline, what Healthusiasm did you witness in the past month?
So my Healthusiasm is about three giants who've partnered together to develop and build smart hospitals in South Korea. So those three companies are Microsoft, GE Healthcare, and LG Electronics. So each of them will bring their own expertise to those smart hospitals. So Microsoft Korea, for instance, will bring AI algorithm models such as Azure OpenAI for hybrid cloud in healthcare, and also Microsoft Teams for staff communication. GE Healthcare will bring medical equipment, command centers, and digital twin technology. And LG Electronics will bring smart hospital technologies such as smart monitors, medical robots, displays, and communication networks. And on top of that, they will also develop operating models for next generation medical equipment, AI medical solution, and digitalization of work. So I thought that was a very good news to see that people actually coming together, combining their expertise to work towards the future, towards such solution we've been talking about, like smart hospitals.
I love the word, and I'm really looking forward as to when we will actually enter a smart hospital. We're getting there bit by bit. It's a slow process. It's good to see that such big companies are entering the market indeed, of course. I'll stay in the hospital and I'll stick with big companies. I'll talk about Apple, NVIDIA, and J&J. And I'll be talking about surgery because the future is bright for surgery. Three examples. One is Apple Vision Pro. We had a specific episode on the Apple Vision Pro. We already mentioned that it could be helpful in surgical training. But now I've read an article where it says that it reduces time for surgical training by 40 to 200%. So that's a very large gap, of course. And it's also not a clinical study, basically it's surgical trainings, of course. But it's pretty interesting. And what he says is that it has to do with the gesture control that these days is phenomenal. There's a lot of cameras in front of the Apple Vision Pro, which allows you to do a lot of manipulations. The video quality is through the roof. And there's also, definitely with the Apple Vision Pro, there's the possibility to integrate other third-party devices like a stylus, but then specifically for surgery. And I think one was the 𝗵𝗲𝗿𝗶𝗆, which looks like a stylus, but which allows you to train to do arthroscopy, for example. A second one is J&J, who partners with NVIDIA. Lovely collaboration. So NVIDIA is the maker of the computer chips for technologies like graphics and AI. And they will deploy surgical software. And the thing is that because of the advantages in what these chips will bring and the power of these chips is that you can actually compute it locally. So it's called edge computing. So you don't need to go into the cloud or you don't need to process it elsewhere. It's really processed very near at the moment of your actual procedures. And it will help to it will help surgeons to navigate through the body, because more easily the AI can tell you this is an organ, this is that part of the body, and so you'll take better decisions. And it would also be the beginning with all the data that they'll gather. It'll be the beginning of surgical robots, of course, which is very promising. And I'll stick with the surgical robots. There's a new robotic system which is called ASTR, the Autonomous System for Tumor Resection. And it's a very interesting robot because it's, the removal of tumor. I mean, I think it's really difficult because you can't remove too little and you can't remove too much as well. So the balance in between is very difficult. And apparently this new type of robot can do it more precisely than a human, which definitely is a good thing if you're thinking about the future of surgery in the space of cancer, of course. Sticking to cancer, or maybe at least palliative care, staying in the hospitals. Mo, you had a very nice example.
Yeah, I think with two topics preceding me being full of tech and AI, I'd like to shift from AI to HI, and HI being human intelligence. Well, there's a really nice healthusiasm for me on a really nice initiative, a low-tech initiative at St. Vincent's Private Hospital in Brisbane. And there's a 92-year-old chap who's literally raising the bar. His name is 𝗵𝗲𝗶𝗰𝘀. And he's not your typical volunteer. He's a volunteer there on the palliative ward. And he began his journey about 2 decades ago when his wife passed away on that palliative ward. And what he does, once a month, he takes his cart filled with drinks and alcohol, and he has a happy hour on the palliative ward, which is nice because it brings a moment of normalcy and joy to patients who participate, proving that sometimes a simple conversation over a drink can make a difference. And there's several reasons why I find this so courageous and clever, because it's about human connection. It's not about the drink. It's really about the conversation he has. He's an experienced person because he's a widower. So he has been there. He's 92. But it's also about normalcy and the ritual. It kind of connects people to a time where they were carefree. And especially, the link we have with alcohol is kind of celebrational. And some people might be offended, but they incredibly like it. And it's also about escapism. I think, we're doing a lot of things to make sure that the ecosystem and the decoration kind of doesn't look like a palliative ward. But I think if you can escape for a moment, and several reasons like community building, volunteerism, and patient dignity is incredibly integrated in that simple gesture. And it's also about psychological comfort. But it also brings forward a theme maybe we should discuss on another time. So there's a healthy life, but maybe there's also a healthy death. So cheers to a healthy life and a healthy death, and cheers to 𝗵𝗲𝗶𝗰𝗀.
I love the example, and I love the suggestion to do a specific episode on a healthy death. I think this is totally worthwhile doing. Would you go and be that bartender? Because he's 92 years old. Would you replace him?
Absolutely.
Yeah,
absolutely. I think I discussed this. My brother has a recurrent cancer, and I thought about it, and I think that the one thing that would hit me the most is that my look. If I would be a cancer patient or a palliative patient, I think the thing that would hurt me most is that the way people looked at me would change. Right? Because then you're reduced to a disease or a patient and if you're just a chap having a drink, in a corridor and having a nice conversation, I think that's a very interesting gesture to give in terms of dignity, so that you don't dilute, your personality doesn't dilute with the situation you're in. So yeah,
I think it also helps battle that sense of the world shrinking for people at different stages in their life. That particularly in palliative care, their world has reduced to almost a dot at that point. And the reintroduction of something that's very kind of human and normal and a little bit irreverent and more celebratory, like you say, Mo, it's so important. When I was a junior doctor during the World Cup in I was asked, the nurses on the ward got us to prescribe a can of beer for the patients who wanted it, one in the first half and one in the second half, because Scotland was playing Brazil, if you remember, back in France, 1998. Brazil sadly won, but it was 2-1. It was exciting. But I do remember how much fun it was to write 1 can of Tennant's first half, 1 can of Tennant's second half, and then 1 can of Tennant's if we win. They never got the last one. But it really, really helped. And you're right, everyone was lifted. And then afterwards, there was a changed dynamic on the ward. So maybe not always alcohol, it's not for everyone, but humanity is important.
Yeah.
I was about to say the same thing. We're in the sobriety trend and the mindful drinking trend, so it doesn't always need to be alcohol, but there's plenty of drinks out there to celebrate, right? Mm-hmm. I actually saw, was it what's the movie again? I always miss up that name. The Shawshank Redemption. Shawshank Redemption, yeah.
On the roof, the beer.
On the roof where they had the beer as well, right? That moment where they all can sit together and they felt human again.
Movies are the other one as well. There's we maybe talk about that another time. Cinemas in hospitals as a way of people being taken in their beds down to a cinema to watch things, but maybe for another time.
Okay. That's good. Yeah, going back to AI. I love the human example, but I'm going back to AI. In the UK, there's a new tool, an AI tool, which is called Foresight. I don't know if you heard about it, Keith. But it's been trained on information using electronic records from 800,000 patients. From the NHS, but also from some publicly available datasets in the US. And actually, the tool predicts 10 potential disorders for a patient. And it has so based on the electronic health record data, right? And it has an accuracy of about 70% in the UK and 88% in the US, which probably means that the data in the US was a bit richer. But that's pretty interesting, pretty valuable, definitely for doctors to be able to see who's my patient, where is he going to, what are the potential disorders. It could even help in creating different digital health solutions or even twins. Clinical trials that you can find the right patients for, etc. What I disliked about it, and then I'll come back to what you're saying more, is that it is very oriented physician, it's very oriented hospital, it's very oriented governmental, predicting the health trajectories of patients. And what I do miss is a bit, we could have included the patient in there. How can they do something with the data, or at least they should have some access to it, I think.
What's interesting about that is I have heard about that, and because I know one of the authors, Josh, and Josh runs his own podcast, and I'll be speaking on that at some point in the future as well. The work of the Foresight team is incredible, and the thing that I think is interesting about it is that it's using the large language model approach, but instead of modeling the language, it's modeling the events, the structured events, and sort of predicting the next event based on the previous ones. It's a very interesting way forward. I accept what you say about having patients' inputs in that, but of course there's nothing, if we can find a way of getting people to bring all their data together, imagine a world where you could have your own personal model trained on your own entire personal record that could then help you understand the likelihood of things coming next with regards to your health and wellness. Could be good, could be bad, but this introduces that concept.
Yeah, and I think it's coming for sure. And I think it's a matter of collecting data outside of the healthcare system as well. And that's maybe what the next Healthusiasm is all about. And then I'll pass the word back to you, Keith. But there's one thing that I read about, Simple HealthKit. Heard about it? It's from the States. Simple HealthKit is actually a diagnostic and a follow-up care kit that can be purchased now on Amazon. In June 2023, they already had a deal with Walmart. And now it's available on Amazon.com. And so what their idea is that 1/3 of the population of the Americans don't have access to care. It's very hard to get diagnosed whatsoever. And so they are bringing these diagnostic tools to the patients, or to the people, even they're maybe not even patients at that moment, doors. So you can order it online, or you can go buy it in Walmart. And there are tests for diabetes. There are tests for respiratory wellness, sexual wellness. You can test yourself for chlamydia, gonorrhea, HIV, syphilis even. You can test yourself for colon cancer, kidney health, those kind of things. And I really like that example because that gives the power to the patients. They can actually collect the data, see what they could do. But there's still examples from the States, right? Do we have successful examples in Europe already?
I think there's just a systematic test you get from the government at a certain age, which is free. At 50, you get a test for everything that is colorectal cancer. You just send the.
But you can't do it at home, right?
Yeah, you can do it at
home.
Okay.
Yeah, at home,
yeah.
The
screening, you just get a
screening
kit.
tests, yeah.
Yeah, the screening test, and it's kind of almost I think what they really succeeded in is making it feel mandatory. Yeah, so I think when you do it, I think they did a good job here to do that at 50, and then it gets you into a repetitive testing. And once you've done that, it's fine, and it's very precise, because if there's even a little bit of blood in the stool, and you go to the hospital and you get a colonoscopy.
Just briefly on that as well, the direct-to-consumer testing market is actually growing quite fast in the UK. So this seems part of it, and there's been the ability to be able to get sexual health testing at home has actually been around for quite a while with sh24 and so on. It's causing a bit of a controversy in the UK, because now in the supermarkets you can buy point-of-care testing, tests such as these for things like thyroid function, menopause, low iron, literally on the shelf next to your paracetamol, like for £5 or £10, very cheap. And these are point-of-care tests adapted from what they learned during the COVID pandemic. The argument, of course, is, number one, are they accurate? And their accuracy is maybe in certain circumstances less than a lab test. And then the second thing is this screening by the back door? And screening tests are chosen very carefully based on the prevalence of illness. We don't screen for some diseases with good reason, because either you can't do anything about them, or they're so fantastically rare that the false positives would overwhelm the system. So there's argument in there, but the principle of improving access to care is wonderful. I think this is a great thing. Personally, I think it's a great thing to increase access this way.
Yeah.
Aline, you were trying to say something.
No, it's just to your point before, that when you do those tests at home, you said that they make it feel compulsory, right? But they don't really check. Like, my dad doesn't do it, and nobody's checking on him if he does it or not. So there's not really a follow-up. So I think it's more like a moral obligation.
Civic duty.
Yeah. But I think in the overall is that we're trying to bring testing closer and less, and lower the threshold. I know that in the UK, for instance, there are centers that test for STDs in the areas where people party. And so I think the proximity between the possible risk and the interception of the risk is something that we're getting better at.
Festivals is the big place. Drug testing too.
Yeah.
And Grindr is also very much known
Yes.
for providing such tests, of course. And I've coached a startup in Belgium as well, who steadily are doing the same thing, and they're doing it pretty good. But it's still, what you feel is it's still a physician-driven market, and it's very hard to find it. It's very hard to know what test to do. So I think we're not there yet. There's some work to be done. Work to be done is also what we can expect from medical students. And then I go to you, Keith.
Yeah. So my Healthusiasm this week is something that I've been involved in this week. I am a doctor that works in digital health and technology, and I love my work, but it was never very clear how to get into it. Medical students these days are very interested in this, but it remains slightly difficult to learn how to get into this. There's little in the way of formal training. But I want to celebrate at least two examples: Imperial College in London and what's something called Learn to Innovate in Cardiff. And basically, these are extra courses that the medical students can take in digital health, technology, and entrepreneurship. The first one, Imperial, I sat on a judging panel for 3 teams as they did a 3-week course and learnt about all aspects of entrepreneurship and product and pitching. And they presented 3 ideas. One was a gamified pill reminder. The second one was a cute avatar-based blood pressure tracking solution. And the third one was quite an ambitious large language model for triage. The quality of the presentations were incredible. I was stunned. Like, I see a lot of startups and so on. And, the way that they spoke, particularly in terms of presenting, was great. Some great ideas, some missteps here and there, but I am incredibly enthused seeing the next generation of doctors and hopefully other healthcare professionals learning how to develop the technologies that we all need for these new ways of practicing medicine. And then later on this afternoon, the Cardiff team, I was mentoring one of the teams who's, I won't spoil what they're building. Hopefully they'll do well. Again, that was over a slightly longer period, but my goodness, they're keen and interested and excited because it gives them some agency over the future of how healthcare is going to be delivered. My main concern is that this is a 3-week or an optional course. This should be within the medical curriculum and in undergraduate curriculums for healthcare. The really difficult question is, what are we going to get rid of to make the space for this? And therein lies a big problem. You can't just keep cramming more stuff in. I have some thoughts as to which subjects could be lost to be replaced by data science and AI. But yeah, wonderful to see this. I've been really, really enthused by it.
Interesting to know. And in that curriculum, were there any specific lessons or courses that jumped out that had nothing to do with medical or science, or like very specific related to management or whatever, or communication or collaboration even?
What wasn't so much, I wasn't so much a participant in the actual teaching of this, although I do teach elsewhere. What is interesting is that the teaching of general entrepreneurship and principles of business is seen as very alien to medicine, particularly in the UK. I don't know if it's the same elsewhere, which is crazy, of course, because the business of medicine is in there, whether you're providing care or not. Having product management put in there was interesting too, because again, people won't understand that as being part of it, but medical students spend time understanding about drugs and drug discovery and biochemistry and organic chemistry and so on. There's no argument about the importance of understanding how medications work. Given the future of healthcare is going to be so heavily dependent on technology such as artificial intelligence, surely we should be taking the same approach with the science and technology so they understand how to apply that too. So I think some medical students, one of the students said that 50% of the people in his class are thinking of not pursuing a career in clinical medicine now, despite being medical students, because they want to do something like this. And I think we miss an opportunity to keep them in healthcare by not offering them the opportunity to learn and practice it within a health system. So I'm enthused by changes like this.
Yeah. I'll challenge that though, because I think I think they need to have some practical experience, but I think in the future, definitely with AI, we will need way, way, way more physicians behind the scenes, behind the algorithms, behind the computer than in front of the computer. I think there'll be two entirely different skills. And the reason why I was particularly asking what type of courses are in the curriculum is because I've worked with quite some startups as well, of course, and the startups that were, and I'm curious to know what Aline is thinking about that, but the startups that were set up and managed by a physician did far less well than any other startup, because
really
they're not used to collaborating, they're not used to accepting feedback, they're not used to pivoting, because they learned a skill that where they need to be the one that's right and where they need to convince other people. Well, if you're running a startup, it's quite exactly the opposite, where you need to adapt yourselves. Do you feel that too, Aline?
Yeah, but I'll agree that you really need to have the different profiles in the team for it to work.
Totally.
And also maybe what I've experienced working also with many teams led by a physician, it's important for them to understand that they are not every physician. So what they think is right may be right for them, but it doesn't mean that it's right for all the physicians like them. So it's important to go out there to validate that idea, because maybe there's no market, and the business aspect, it's something that you learn that maybe they're missing, because that's not something that you learn at medical school, right? So, yeah.
I totally hear what you're saying. I've worked with some physicians that had great ideas, but overvalued the effort people were willing to put into the idea. And also the effort that patients were willing to put in the fact that, is it useful? Yes. Is it scalable? No. Is it viable? No. And when they hear that, they just find someone else to make it work, right? Because they cannot let go of that idea. There's also often, Aline, an ego thing that they found something and they want it to be good. So it's true that these various dimensions of challenging an idea and making it a viable business is something completely different. And lastly, Keith, I think those students might also have a premonition that their main supplier, which is government, who provides patients, might dry up. Mm-hmm. And there will be entrepreneurs that need to find a way, with out-of-pocket cost raising, to really build businesses that people will pay for in a different way, and build those, that business acumen in a different way. So, yeah.
I think it's really great to hear your opinions on this. And actually, I think, Christoph, your sort of counterpoint on this one, I actually think we're closer, but I think we're actually closer in agreeing on this one. I think doctors can make terrible contributors to health tech companies, right? I'll say that off the bat. Just because you're a doctor doesn't mean you're going to be great at it. I think you have to learn this. So this is where I'm coming from, is that this is the beginnings of the learning, and some of it can be taught. But I also think the experience of living the reality of it is critically important too, going through the pain of this. And when I've previously done a lot of work and interviews with startups and companies about the value of their clinical subject matter experts, and they almost universally talk about two really important things that the doctors and nurses and whoever they bring in to help or work with them need to have: commercial sensibility and humility. And I think that's what we're maybe talking about here. And the humility is an interesting one because it varies from place to place, how it comes out and over time. But it is important that whoever's contributing plays a part in the team. And that means that they have to know what they can do and when they need to work with others. So, yeah, really interesting point.
Guys, I see an entire podcast on health entrepreneurship and maybe a masterclass, with the expertise that we have here. I think there's something to be said, especially with our look forward, Christoph, with your book coming out, how the aspirations might change, and at a different level, technology will accompany that. There's incredible value there, I think.
Yeah. That's a great idea. Again, it's a second great idea. Third great idea you launched recently. Thank you. We'll stick to that. But first, we'll end this episode with some unusual Healthusiasms. I got one for each one of you. And I'll start with Aline. Okay. So maybe you might know this quote. If it's not on Strava, it never happened. You heard of it?
No.
So it's typically, you can say that you work out, but in your mind, if it's not really recorded on one of your devices, it doesn't feel like you worked out because you need to see the data, right? But there's this, related to that, there's a trend. It's a small trend. It's a social media kind of trend. It's not a macro or societal trend, but it is related to women's health, where women record and post on social media certain events as a workout on Strava, and they're not your typical workouts. And I'll give you a tip. I recently saw one on X, on the former Twitter, and the workout was 5 hours and 37 minutes. The average beats or heartbeats per minute were 81, and the woman lost 914 kilocalories. What was the workout, between brackets, that she did?
I would say housework.
No.
Was she alone?
She was not really alone, no.
Aline, trying to help you.
Do you want to go for a guess, or?
Well, I will be I was wondering if this was intimate relations, but the 5.5 hours part of it I would be impressed, and I think the man would probably be posting that if that was the case, or the partner might be. But I'm going to
close to it.
Says it. It's close. It's intimate relations, I'm going to say.
It's the consequence of intimate relations.
Oh, childbirth.
Childbirth.
Ooh.
Exactly.
Oh, wow.
So people put their wearables on during childbirth and then post online how long it took, how many calories that they've lost. And they, put it online as a workout. And it kind of makes sense, because in the article that I wrote is that There were studies that were published that they referred to in the American Journal of Obstetrics, and childbirth can result in more extreme injuries that require longer recovery times than those sustained in a marathon. Study published in Science Advances said that pregnant and breastfeeding people push their bodies past the level of extreme endurance athletes in terms of energy expended over a long period of time. So that is what we now see on Strava, childbirths.
So would triplets be a triathlon?
With or without the cesarean?
Or one with a water birth? Yeah, you have a normal, a water birth, and then the cesarean for the third.
Anyway.
Or maybe no sedation could also be one.
Oh yeah. Could change the heart rate though. Yeah.
I'm going to flag the fact that we've got three men joking about this in the I think we don't have really much to add here. So
absolutely, all my respect. I was there. We had my ex-wife had a 24-hour labor, and I said, "We're just pussies."
Okay, I stick to you, pussy. Angry girlfriend is a new chatbot. What's so specific about the new chatbot?
It teaches you how to connect back to your girlfriend if she's angry. It teaches men that.
Lovely. It's exactly that. It's exactly that.
Oh, really?
Yeah, it's exactly that. It's also called a toxic digital nag bot, from the verb nagging.
That's less nice.
But so the thing is, the idea behind this is that typically AI girlfriends, they're built as low maintenance, always down, they won't fight, nitpick, whatever. But here the angry girlfriend claims to offer a gamified approach to developing girlfriend-specific communication skills. So exactly as you said, Mo. Exactly as you say. So the app simulates possible real-life scenarios, so that you can actually, have that discussion. Perhaps she spent too much money on clothing, or she lost money on the stock market, or she reacted to the fact that you talked to somebody on socials, and then you need to intervene and have that conversation.
I think we should track the calories we put into that too.
The categories? I mean,
the calories of the efforts.
Strava.
And then post it. Posting your arguments on Strava.
Yeah, 5 hours, 900 calories.
Just because of the stress.
We got there.
Yeah, I think as long as, this is all great. I think that there should probably be something equal about like awkward boyfriends and awkward partners and so on as well, because I've been a crappy part of a relationship as much as anyone else.
No, fair point. It's just that, the AI girlfriend apps are, of course,
right enough, yeah.
Very popular, and so I like the fact that it's a counterbalance to have that little bit of a pressure and a learning curve, indeed, as you were saying, Mo. Last one, Dr. 𝗵𝗲𝗍. You know her?
I know of the lady's work. Yes.
Yeah, so she is she's a female American rapper, and she has a collaboration with Nike. And the collaboration is called the 𝗁𝗲𝗍 Revolution, and it is rooted in well-being. What could it be? The 𝗁𝗲𝗍 Revolution.
Is it hot? Do you say hotty or healthy?
𝗁𝗲𝗍.
Hotty as in hot. Okay.
As in hot.
Yeah. So I would imagine this is potentially something about the health and wellness benefits of dance and partying of some sort. That's where I'm going to go to on this one. When you talked earlier on about the 5.5 hours, I was wondering whether people were posting, their heart rate having gone to a rave or something. So I'm going to stick in that area and go and say, is she partnering on like party metrics?
It's not exactly right. It comes close, but it's not exactly right. Does anybody else wants to jump in and make a guess?
I would have said it has to do with sneakers that makes you run faster, and then so you're hot because you're running so fast.
No, nice one. No, it has to do with sneakers. It has to do with, if you will, dancing, but it's more about the attitude. It's about how you feel, and the fact that you are allowed to feel good. That it's what she called it, the being unapologetically you. So it's more than how you look. It's about how you feel. It's about finding joy. It's about for just enjoying who you are, being in that moment, moving the way you are, and it's for everybody and every type of body. So it's a kind of positive body movement, if you will, making sure that your mental health is okay and that you're allowed to just go out and be a hottie. Let's put it that way. I find it funny, but I think it's worthwhile. Definitely with her audience, I think it's worthwhile putting it forward that you can be proud about who you are. Well, great guys! Thank you all for these healthhusiasms, and thank you all for making this a healthhusiasm world indeed, because there are, as we've just seen, so many positive changes that are making our world a little healthier and happier every day. Time to wrap up the Healthusiasm podcast for this week. Thank you for listening. If you like this show, don't forget to hit the subscribe button on your favorite podcast platform. You can also visit healthusiasm.com to discover the other episodes, subscribe to the newsletter, and learn more about our panelists. For now, I'd like to thank our panelists for their healthhusiasm. Thank you, Aline Loiset, Dr. Keith Grimes, and 𝗵𝗲𝗍𝗏. My name is 𝗵𝗲𝗍𝗀. We are the Healthusiasm panel, and we'd love to see you again next week for some more healthhusiasm. Ciao.